Good morning.
Good morning.
My name is Miss Brower. Today I shall be teaching you about emergency episodes, namely 1, bleeding, and the steps that you need to take when someone is bleeding. As this is an emergency episode, it requires immediate action, and we need to get that action right to prevent further implications. Let's begin. Alright everyone, so let's manage some emergency episodes, acting fast, acting efficiently. You have a patient, Miss Brower. She's in the room, and you can see that she's bleeding quite profusely on the ground. So what will you be doing, Millie? Step 1, danger. Check for danger. Is there anything on the ground like a cord or a pool of blood that you could fall on? If that is clear, move on to step 2. Call for help. So, help, there's a bleed. Alert your management and everyone around you. You want to get your 3rd step. Assist the person to sit down, because if they're losing a lot of blood, they have a very high potential that they might faint. Yeah. So the 1st step, you're going to see the wound, you're going to check for danger, and then, if possible, apply a glove. Yeah, if you would like to apply a glove. You want to put on gloves for a few reasons. First of all, for your own safety. Blood is a high transmitter of disease if you think of HIVs, hepatitis. So you want to make sure you're protected first. Obviously, if this is a life or death situation and there are no gloves available, you're still going to try and save that person's life. So, step 4. Once your patient is sitting, you have your gloves on. You're going to need to apply firm pressure to the wound. Ideally, applying a gauze to the wound to help promote clotting. Would you be so kind as to apply?
I will. So do I just hold it onto your arm?
Yeah, so you're going to apply the gauze directly over the wound, bearing in mind too, if you have a very open wound, squeeze the skin together and then apply the material gauze.
Okay.
So that is some good pressure, but I'm looking for even more. So really applying this pressure to the wound for a number of reasons. The first of all reason is that it's going to promote clotting. Clotting is vital in the healing process, and it is going to help close that wound and stop the bleeding. As you can see, this is a very large wound, and this little piece of gauze might just get saturated. What are you going to do in that situation?
Do we add on top of the gauze?
Exactly.
Okay.
So you're not going to remove the gauze, because if you have a blood clot that has become one with the gauze, you're going to be ripping that blood clot out, which we don't want.
Yeah.
You're going to keep the firm pressure on if necessary, and if your patient is willing and able, ask them, please keep this firm pressure on your wound while I get some more gauze to help with this problem.
Yeah.
So that brings us to our 5th step. If bleeding persists and drenches the cloth, do not remove it, but apply on top of the saturated gauze. So if you want to ask me something.
Okay, so do you want to hold pressure on this while I get the bandage out?
Yes. Oh, you have some gauze. Perfect.
Gauze. Okay.
So now, if you get me to assist you in holding this.
Yep, so if you just keep on holding that down for me.
I've got it. Yeah.
Good.
A technique that you can use is if you just have one finger on this while you keep it in place, you can pull it out and then it's in place for good. Splendid rolling.
And tell me when to stop.
And stop. So, we now have some more gauze on the wound This will also keep your other gauze in place at a firm pressure.
Yeah.
Although you're still going to want to keep the pressure on if the gauze is too loose. Or if you can't wrap it and the gauze is just sitting there, gauze on gauze on gauze.
Yeah.
So you want to keep the pressure there, but this is nice and tight. Thank you, Millie. Now in this situation, don't fret if you ever need to take this gauze off. You can simply get some scissors, cut along, remove the gauze if required. Now, the last step on the list. Take my vital signs. You want to make sure this patient is stabilizing now. You can assess that by the blood pressure, by the heart rate, and just by their overall status. If they are now regaining consciousness, are they calming down? And obviously follow this up with, do we need to re-stitch a wound? Do we need to check for other injuries?
Yeah.
So, thank you. Thank you, Millie, for assisting me with that short demonstration. Now that we've gone through the primary management of bleeding steps, please complete the worksheet now.
I did this. Here's my sheet, I've just finished.
Our class is almost drawing to an end, but the last thing I would like to teach you about is a little thing called hypovolemic shock. This is a shock that is a physiological change that happens in your body when you lose up to 50% of your body's blood. There is a lack of oxygen in the tissues. Your organs finalize their life. Keep an eye on your patients. Check them regularly, ask them questions. Do not be afraid to flip up the blanket and see what's going on. Our patients' lives are in our hands. Thank you for listening to my lesson on the management of an emergency episode such as bleeding.